An estimated 15 million people have been diagnosed with chronic obstructive pulmonary disease, or COPD, but an estimated 24 million are affected by the disease. COPD ranks as the third leading cause of death in the United States, trailing just behind heart disease and cancer. Since there remains no cure for COPD, the focus is on prevention, early diagnosis, and innovative treatment options to help patients manage the disease better. For most patients with COPD, breathing can be a day-to-day challenge. Linda Bray knows this all too well.
I was on oxygen 24/7. By that time, I started having anxiety attacks. It felt like I had a big concrete block on me. You don't want to ask for help. You don't want to bother nobody. And you think you're an invalid wearing your oxygen. That's the way I did for quite a while. You sit and you feel sorry for yourself.
Linda is not alone in her struggle. While COPD presents many challenges, the good news is that this is a treatable disease. Pulmonologist Dr. Brian Carlin explains that patients with COPD need to be informed routinely of their options for managing their illness as their disease progresses.
COPD includes chronic bronchitis and emphysema. It's usually and almost always associated with cigarette smoking, and it is an illness that progressively worsens over time. Depending upon the stage of COPD that a person might have, they may have 1 or 2 flare-ups or exacerbations each year. People that have more severe disease or more severe illness can have 3 to 5 or even more exacerbations per year. That illness is often due to a bacterial or viral infection and can lead them to need to seek medical attention and sometimes even hospitalization. What happens then, the patient often will go home from the hospital, and in many instances just not being sent home with the right medication or therapy, and then they come back to the hospital and then need hospitalizations.
Although guidelines for the diagnosis and management of COPD currently exist, many clinicians may not yet be familiar with them or have yet to implement these guidelines in their practices.
There are great guidelines and recommendations that have been put together by people all across the world that really focus on the patient. The goals of COPD treatment include relieving your symptoms, slowing the progression of the disease, improving your exercise tolerance and ability to be active, preventing and treating exacerbations, and improving your overall health. We should be assessing patients based upon recommendations from the GOLD group. First of all, we need to ask them how they're doing. There are various questionnaires that can help with that, and oftentimes what I do is just ask the patient directly. Are you short of breath? Are you coughing? Are you wheezing, for example? And then the other thing I like to ask them is, are you doing the same amount of things that you were doing a couple years ago? Many people that have COPD will actually do a little bit less because they can't do it.
The disabling symptoms of COPD can often be controlled and disease progression slowed through effective management of treatment.
The main components for treatment of COPD include both pharmacologic and non-pharmacologic therapies. Pharmacologic therapies include 2 types of therapies. The short-acting medications are known as rescue inhalers. Ideally, a patient should be on a long-acting medication. If a patient is using their short-acting medication, or their rescue inhaler, a lot, it may mean that the disease is worsening or that there is something else occurring that is not allowing for the optimal control for that individual patient. The benefits of all these types of inhalers, whether it be a dry powder, a metered dose, or a soft mist inhaler, is when used appropriately, they work and they work very well. The challenges of both the dry powder inhalers and the metered dose inhalers are really twofold. The first one is to actuate the device and inhale and coordinate that with your breath. The second challenge is actually taking a deep breath and holding that deep breath. Some of our patients can simply not take a deep breath. We just have to make certain that our patient is using that device in an appropriate fashion, because that's going to optimize their care. There are a lot of reasons why nebulization therapy may be a good choice for an individual patient. A patient simply may not be doing well on other types of metered dose or dry powder or soft mist therapy. A patient may be cognitively impaired and cannot use any of the inhaled devices. They may have just generalized weakness and they simply can't coordinate that hand-breath coordination. They may not be able to take a deep breath and may not be able to inhale the dry powder, for example. And we see that in many, many patients. And in those instances, nebulization therapy is a very appropriate alternative to optimize the care of the patient. Today's nebulizers have undergone a lot of innovations compared to those 25 years ago. They're smaller, they're certainly more portable. We recently completed a study, a questionnaire study, through the American Thoracic Society that looked at physicians' knowledge and attitudes regarding nebulization therapy. One of the things that we found through that were 7 of 10 physicians felt that nebulization therapy is the treatment of choice for patients who have acute exacerbations or flare-ups of their illness.
I didn't realize that for several weeks, that I was doing better until I sat down to supper one night with my husband, and he put his hand on mine. He said, "I've got my old Linda back. Don't sit and give up, please. Make it up in your mind to get up and walk, if it's just around your table. In your heart, you know that you're not going to get over it, but you can live with it. You really can."
Work closely with your healthcare team, find the medication delivery system that works best for you, and follow your treatment plan. You'll find that COPD doesn't have to leave you fighting for air. For more information about living with COPD, visit copdtogether.com or just log on to accesshealth.tv.